Welcome to Working for Women, the Independent Women's Forum podcast, where we are changing the conversation about women and public policy for the better.
Hello, I'm Carrie Lucas, President of Independent Women's Forum, and I'm joined by IWF's Policy Director, Hadley Manning, to talk about short-term insurance plans. Hadley, before we jump in, can you tell us a little bit about what that term even means?
Yeah, it's something that's kind of changing now. It's a sector of insurance that's expanding because of some of the ways the Trump administration is changing regulation of these plans. But typically, someone would buy a short-term, limited duration health insurance plan, in the previous world when they didn't have a lot of other options and when they just needed coverage for a short period. The Obama administration limited these plans to a coverage period of less than 3 months. So something like 90 days, you could have a short-term health insurance plan. But now we're seeing that these plans are kind of getting greater use, and we can talk about that. But they really weren't intended to be health insurance that people would use, for a period of longer than a few months.
Okay, but so what did the Trump administration change about these plans?
Well, they changed the duration that people can use them for. So now you can use a short-term limited duration insurance plan for up to 12 months. And you can also get extensions or renewals of these plans up to 36 months. So this means that basically these plans more or less will be interchangeable with the individual insurance plans that also exist on the market. But the important thing to consider about these plans is that they don't have to meet all the same requirements that other individual market insurance plans have to meet under the Affordable Care Act or Obamacare. So under the Affordable Care Act or Obamacare, individually purchased insurance plans got brought to a very high level of regulation across all 50 states. Prior to the ACA, every one of the 50 states sort of regulated their own individual plans. Some states had very high levels of regulation. Some states had very low levels of regulation. And it's not surprising, but the states with the least amount of regulation had the cheapest individual market plans. So if you were a young, healthy man or woman, you might be able to afford one of these plans for less than $100 a month. But of course, after the ACA, we saw that those premiums for those plans increased dramatically. And the flip side of that coin is that the ACA tried to provide subsidies for people, especially people with lower or moderate incomes, to buy individual market plans. But if you were someone who is in this market, meaning you probably don't have access to an employer, benefit of health insurance, you're not qualified for Medicare, Medicaid, or veterans, benefits when it comes to health insurance, then you better hope you get a subsidy, because we've seen these premiums for individual market plans, double, triple. Every year they increase by about 20%. So people in this particular subset of the market have had a rough ride, particularly those customers who can't get subsidies. And so the changes to the short-term limited duration insurance plans are really an effort from the Trump administration to address that particular subset of the market and offer a new, more affordable option for people who are there.
Yeah, this sounds like good news. I mean, this is always confusing stuff, and there's a lot of kind of moving parts when it comes to health insurance markets. But it kind of as a bottom line, it sounds to me as though this is giving people a new option. And I think from any other and kind of any other area of life, when people have new options, obviously everything is voluntary. But if there's a new choice they can make, we see that as something good for people. So I'm kind of confused as who would be against this and what the kind of criticisms of these what the criticisms would be.
Yeah, well, you may recall, Carrie, in about 2013, in that fall of that year, if you were somebody who was buying your own insurance, it was very likely that you received a letter in the mail saying, hey, as soon as January 1st, 2014 rolls around, this plan's not going to be available anymore. We're canceling it, or we're making serious changes to it. It's going to make it a lot more expensive just to meet the regulations of the ACA. I was one of those people. There were millions of people across the country who got letters like that. And the response from people who supported the ACA generally was, well, we're better off without this option. We're better off without those plans, those choices for people, because those are junk plans. They say they don't cover enough stuff. They don't, force people to buy maternity coverage. They don't force people to meet the so-called essential health benefits package as defined by the Department of Health and Human Services under the ACA. And you're right. It's a bottom line that's sort of the fault line lies among different philosophies. If you believe that individual consumers and patients should have the freedom to choose health insurance, even if it's more basic, even if it doesn't meet the laundry list of features that Uncle Sam says that every health insurance plan has to have, well, then maybe you don't like the idea that people have more options. Maybe, you don't believe that people ought to be free to choose a skimpier plan. And skimpy is a term that people on the left like to use to describe coverage that isn't, doesn't have all the bells and whistles. But if you're someone who believes that, consumers and patients are perfectly capable of, understanding what they're buying and making the choices that are right for themselves, for their families, interpreting, not just what features are covered or not covered, but what levels of risk financially are appropriate for them, then, you would celebrate the fact that people have more choices, not just because of this change under the Trump administration, but because of a handful of changes that accompany this deregulation of short-term insurance plans. The Trump administration's also tried to expand the use of association health plans. And of course, President Trump signed the repeal of the individual mandate, which, I kind of had a chuckle when you said everything's voluntary, because it's not voluntary when there's a mandate in place that you buy this stuff. But now it is up to consumers, and the Trump administration is really working to expand choices. And I do want to make one note here about these plans. If you're somebody who has a very serious health condition, and, if you go through a medical underwriting, or if you are looking at a health insurance plan that doesn't cover a lot of stuff, and you're going to be on the hook for a lot of out-of-pocket expenses, then maybe this option isn't for you. I don't think the administration is, blind to the fact that this is not an option that's right for everyone, but they're seeking to address a subset of people in the market, particularly unsubsidized, healthy customers in the individual market for insurance who have just taken a beating under the Affordable Care Act, with a new option. And for those people, the premiums for these short-term limited duration insurance policies are approximately, on average, I want to say about $125 a month. That's the average monthly premium for one of those plans, at least as measured in the fourth quarter of 2016. You compare that to the same measure for an individual market plan that does meet all the ACA regulations, that's $393 a month. So people who, are good candidates for this type of coverage are looking at saving hundreds of dollars every month. And that really adds up. So that's something that, people are going to appreciate. They're going to take that to the bank.
Yeah. Well, Hadley, this is insurance regulations are such a confusing topic. And I really thank you for explaining this to me. This is one of those, I feel like often the headlines are really helping us miss the big picture. So I appreciate your clarifying this. And thank you to everybody who's listening. For more information like this, please come visit us at IWF.org, where all issues are women's issues.
If you enjoyed listening to this podcast, please give it a thumbs up, share it on social media, or stop by IWF.org for similar content.